Alright guys, now we're going to cover question number 2 of topography, which is the temporal region. Okay. If you guys remember question 1 from topography, it was the Calvarian covering. Now, if you guys remember the acronym SCALP, which were different layers covering the calvaria, you had your skin, you had your subcutaneous connective tissue, you had your gallia aponeurosis or gallia aponeurotica, you had your loose connective tissue, and you had your periosteum. Now in the temporal region, it's a bit different, okay, because of the fact that you have your temporalis muscle, okay. So it changes a few things, but not really, okay. First, you're going to visualize the temporal region. Once you visualize the temporal region, let's start, okay. So you have your skin, you remove the skin, okay. Then you're going to see a superficial fascia. You're going to remove that, and then you should see in this region, you should see the temporal parietalis muscle. As you can see, it has been removed because these are the auricular muscles. I want to show you a picture real quick just to show you how the temporal parietalis muscle should be. This is one of the locomotor theme books. Right here, this would be your temporal parietalis muscle. One of the muscles along with the occipitalo frontalis, which would insert into the gallia aponeurotica. Okay, but in this case, in the Lectures Atlas on page 25, the temporal parietalis muscle has been removed in order for you to view the temporalis fascia, which is the main bit for the temporal region. As you know, the temporal parietalis muscle originates from the three auricular muscles. You have your posterior auricular muscle, superior auricular muscle, anterior auricular muscle. You remove the temporal parietalis, you will see the auricular muscles, and you'll see them covering the temporalis fascia laterally. You have to know that the temporal fascia has two layers, and in between there's going to be loose fatty tissue. The temporal fascia has a high attachment and it has a low attachment. The high attachment is going to be the superior temporal line on the parietal bone. Let me show it to you guys. If you use one of the theme pocket atlases, they're quite detailed. So if you go to the parietal bone, you're going to find a superior temporal line, you're going to find an inferior temporal line. The high attachment of the temporalis fascia will be the superior temporal line, and the low attachment of the temporalis fascia is going to be your zygomatic arch, which will be right here, and it's going to be the temporalis muscle itself, okay? Those are the attachments of the temporalis fascia. So if you remove the two layers of the temporalis fascia, you're going to find the temporalis muscle, and you know the temporalis muscle originates from the temporal lines of the parietal bone, which would be somewhere over here, and it's going to insert all the way to the coronoid process of the mandible, okay? Not the condylar process, the coronoid process of the mandible, okay? And you know, you guys may have done, or if not, you guys will do, the fact that the temporalis muscle and the lateral and medial pterygoid, and also the masseter all are masticatory muscles. Therefore, they're all going to be innervated by the motor masticatory branch of the mandibular nerve of the trigeminal. Okay, and that's your temporal region.